Today we will talk about obesity in dogs, and we will see how does diet at young age impact future obesity, and we are comparing between dry and raw food. First, we need to know what is obesity. It is simply like having much body fat, and we can define it as having about 20% or more than the normal ideal weight. And we need to take into consideration that the ideal weight can vary from breed to another. As we see here, this 9-point scale is usually used for the evaluation of the body condition score in dogs. If we look to number 1 and 2, it representing the very lean or very thin dogs, and picture 3 to 4 representing the lean dogs, and number 5 is the ideal weight dogs. Dogs from between 6 and 7 is considered overweight dog or obese, and if we have dogs shaped between 9 and 8, it is a very obese or obese in some evaluations. Okay, from the current study, the study sample we testing, the prevalence of obesity in the current study sample is between 13 and 14. And when we looked through the literature, we found that some sources reported that the obesity ratio is over 50, which makes us consider a degree of underestimation by the owners for what is their dog's body condition score. And we take this into consideration while we are collecting the study sample of the current study. If we need to know, is obesity dangerous? Yes, it is. It has been recognized as a disease due to its complexity and due to it is incorporated in a lot of health complications. By searching through the literature, we collected these averages of the risk of health issues associated with obesity. For example, the obese dogs is 4 times at risk to develop joint problems compared to normal weight dogs. And for the liver diseases, gastrointestinal problems, it is 3 times more. And also for heart diseases and urinary problems, it is 1.5 times more. And it is for reproductive, skin, and respiratory problems, the risk is twice. Here are some nice articles reporting the risk of obesity. We found that a study published in the veterinary clinics reported that there is a similar list of health issues associated with obesity, including the inflammatory mediators are increased, which can in turn increase the risk of cancer later or can be a start of any other inflammatory disease. Also, a study done by Alex German reported similar list in addition to the connected obesity with different kinds of cancer, and also impaired lipid profile and possibility for some complications during anesthesia due to difficulties in the respiration and in respiratory collapse. Also, a study published by BMC Veterinary Research, they compared between the body condition score in patients with heart disease and healthy patients. They found that the body condition score was higher in patients with heart disease, both in male and female population. And as we see here, the body condition score either in healthy and heart disease patients was even more in female dogs. Another study done by Susan Wen, they linked the obesity with the increased risk of urinary tract infections. So we need to know what is the risks for obesity so we can avoid it. Risk factors for obesity can be modifiable and non-modifiable. From the non-modifiable ones, we have the breed. Large-sized breed dogs are more prone to gain weight more than the small-sized breed dogs, and also the medium-sized dogs are more obese than the small-sized dogs. Also, older dogs can gain weight and store fat more than younger dogs, and also it is known that females are prone to gain weight more than males. From the non-modifiable variables, we have the diet. if we look for some of many high carbohydrate diets, we found that it is associated with some impairment in the glucose response and associated with glycemic or high glycemic response, which ending in shifting or altering the metabolism in a way conductive to fat gain. While, for example, had high protein diets, which promotes the satiety and can maintain normal insulin sensitivity. And for the level of activity, we found that having enough outdoor activity simultaneously with enough resting hours or sleeping hours can help to maintain normal metabolism in dogs. And also it is known for some health complications or some health issues to be associated with stimulation for weight gain, like for example hypothyroidism and Cushing disease in dogs. So how we can overcome or prevent this disease? In case if we have adult obese dog, it will be not easy to lose weight because it is a little challenging, and in most cases there is a resistance to weight gain, to weight loss. But it can be doable if you follow a strict diet intervention and more exercises, and maybe sometimes by using certain medications. Because obesity is not that simple, and it is not like energy intake and energy loss, or energy in and energy out, but it is its risk is complicated or compounded over time by the continuous exposure to obesogenic environment, either prenatally or postnatally. The early life exposures either inside the uterus, prenatally, or after birth postnatally, during the neonatal period and during the babyhood period, is strongly affecting the further or future metabolism of the body. So by running diet intervention during these critical life of periods, we will be effectively able to prevent the obesity in dogs. And for that, and for helping owners to overcome obesity in their dogs, we done this study, which is a cross-sectional longitudinal study. We looked for the association between early life exposures and the later development of obesity. In the current study, we test the Dohan hypothesis, which suggests that the early life exposures have a long-lasting impact on individuals' risk to obesity and metabolic syndrome. In the current study, we tested 4 early life stages. We started by the prenatal life, in which we tested the maternal diet during pregnancy, if the mother was vaccinated or dewormed during pregnancy, and later we tested the neonatal period, in which we tested the maternal diet during lactation, also some factors related to the home, like an environment, like season of birth, and later we tested the babyhood exposures during the period from 1 to 2 months of age, in which we tested the baby diet, hours of outdoor activity, sleeping hours, and kind of floor using by the baby. And later we continued to the babyhood period from 2 to 6 months of age. We also tested similar variables, including the diet and environmental ones. The dependent variable used in the current study was collected based on the answer by the owners to the question regarding the body condition score in their dogs. In the available answers in our DogRisk food frequency questionnaire was based on the 5-point scale for evaluating the body condition score, where we have very lean, normal, obese, and very obese. In the current study, we take away or excluded the very lean dogs to avoid any interaction with any suspected underlying disease. Also, we avoid the normal weight dogs due to the potentiality of underestimation.
we don't have to run out.
Somebody's telephone.
Please go on.
We tested 23 different independent variables for the association with dependent one. Most of these variables we already mentioned, and regarding the diet, we are comparing between raw and dry food. In addition to these modifiable variables, we also tested some non-modifiable variables like breed, age, and gender, and kind of dog. In the current study, the study sample was about 282 dogs, from which we have 390 obese dogs and 2,492 lean dogs. The study sample obtained after the previous excluding, in addition to excluding dogs under 6 months old to avoid the reverse causality. And the statistics done by SPSS, version 29, the initial screening done with cross-tab, then we got the final results using the logistic regression analysis, which done into 4 models. We got some interesting results. From the first model, testing the non-modifiable variables, as we can see here, the size of the dog breed. The medium breed dogs is at risk to develop obesity 1.7 times more than small dogs. Also, the larger breed dogs is nearly at risk 1.8 times compared to small dogs. And when we tested the mean use of the dog, we found that hunting dogs had a reduced risk by 0.24 times compared to pet dogs or home dogs. And any other dogs doing any other dog activity had a small risk by 0.24 times compared to pet dogs. Also, female dogs is at risk 1.6 times compared to males. And when we tested the maternal exposures, we could not get any significant variables to stay at the end, but the maternal diet during pregnancy showed association where if the mother was consuming raw food during the pregnancy, the risk was reduced by 0.5 times compared to dry food, while dry food increased the risk nearly 12 times compared to raw food. It's not significant, but it's worth mentioning here. And then later from the young puppy model, we got that the puppy diet consumed as a first solid diet by the young puppy was significantly associated with the onset of obesity later in life. When the puppy was weaned on dry food, the risk was increased 5.5 times when more than when it was on raw food. And the opposite can be seen with raw food, where the risk was reduced till 0.18 times compared to dry food. And also, the body condition score of the young puppy was significantly associated with later obesity, where we found that the normal weight dogs had a reduced risk by 0.5 times to develop obesity later compared to overweight dogs, while the underweight dogs even has lower risk by 0.3 times compared to overweight dogs. And when we tested the last model for the puppy from 2 to 6 months old, we found that the puppy diet, when it was on dry food, the risk increased by 1.6 times more than raw food, and the raw food reduced the risk by 0.6 times compared to dry food. And also the body condition score associated also significantly here, where we found that the normal weight dogs have a reduced risk by 0.3 times compared to overweight dogs, and the underweight dogs also have a reduced risk by 0.1 times compared to overweight dogs to develop obesity later. And here we got an extra variable, which is the sleeping or the rest hours. This is a combined day and night sleeping hours, and we found that dogs sleeping between 13 to 20 hours per day have a reduced risk by 0.5 5 times compared to those who sleep less than 13 hours per day. And the outdoor activity was significant in the univariate, but it does not stay in the final model. Later, we will conclude our findings. I collected the protective factors together and the response together to be easy for you to follow. Here are the protective factors identified by the current study. It's like consumption of raw meat-based diet during maternal, during pregnancy and as a weaning diet, and consumed by the baby from the start of 2 months till 6 months old. Also having normal body weight during babyhood, either from 1 to 2 months and from 2 to 6 months, and having enough sleeping hours, not less than 13 hours per day. All of these are protected against being obese later in life. And for the risk factors, we found that the consumption of dry kibbles or dry food during pregnancy and as the weaning diet or first solid diet and during babyhood associated significantly with the incidence of obesity later in life. And being chubby during babyhood and sleeping less than 13 hours per day also disturbs the control of the body weight and is predisposing for later obesity onset. And this picture is our take-home message for you. By looking to this picture, you can easily identify the major and strong modifiable factor for obesity discussed by the current study, which is food. Dry food is associated with overweight, and raw food can help maintaining normal weight.